welcome to Bikebite. Well, today it's Car Bite. I'm your host, Dr. L. And the weather is rainy. Bye, Bike. Alright, so what are we talking about on this lovely day today? We're going to talk about Mom and Dad's one of their worst nightmares. Little Adam or Little Abigail is playing at the park on that second-story play equipment, falls, and bam, right on the face. And when they get up and look at you, there's a tooth out right here. What do you do? Alright, first of all, this video alone is for informational purposes only. You should only, and I want to reiterate, only use this information for practical purposes after you have had a face-to-face conversation with your dentist. Now, in this day and age, we have a really great advantage. Cell phone with camera, instant connectivity. Now, I would talk to your dentist, and hopefully they feel the way I feel. Anybody who's my patient who wants my cell phone number can have it. Then you can send me a photo of the tooth, a photo of the child's mouth, and I can walk you through what to do. Is this a baby tooth? Yes? We don't care about a baby tooth. Leave it alone. Just come and see us the next day to evaluate the trauma. We're not going to try to put that tooth back. Too much risk with not enough benefit. Is it an adult tooth? Well, little Adam or Abigail only has one set of those, so we're going to try to fix it. Do not scrape the tooth. There's a bunch of red gunky stuff on it. That's important. That's critical. If you scrape that tooth with your fingernail or with a knife or a tool, we can't put it back. There's just no saving it. We need that ligament intact. If you are going to your dentist right then and there, put a little cup of water. Keep it hydrated. Don't let it get dry. The first hour is very critical. From about the time we have the tooth come out to within an hour, the chance of success goes from about 60% chance of success to close to 0% chance of success. This is not something that can wait until the next morning. We have to do something now. Now, this is going to sound crazy, but that tooth needs to be reinserted. What we would do, if you brought your child to us within that first hour, is make sure the tooth is clean of debris that could cause infection, and then reinsert it into the socket. Now, there's a couple of mistakes that can be made here if you're a parent. This is why I say this is not a DIY video. If you don't know what you're doing, and you insert the tooth backwards, it's not going to be viable. If you do not put the tooth in far enough, the tooth is not going to be viable. And again, a picture is worth 1,000 words. If you take a picture immediately after putting it back with your dentist's guidance, we can tell you it looks like you did a good job, or that tooth is not fully inserted, you need to push. It's current Western thinking that the nerve is not going to survive. The goal here is to allow the ligament, the attachment, to heal. You got to get the kid to the dentist that day. You cannot wait till tomorrow. We need to put some ligament around that tooth to stabilize it. Now, don't go DIY in this and use some fishing pole wire with some super glue. That's just too hard. It's going to keep the tooth from moving. Totally rock solid. It will not work. It needs to be flexible. So you bring the child to the dentist. We put on some flexible ligament, usually orthodontic rubber, and then we fasten it to the two teeth next to the one that's been knocked out with some filling material. How much does this cost? The last time I did it, I didn't charge anything for the reinsertion. It's such an unpredictable procedure that I don't feel like charging for it. And I charged about the amount for a normal filling to tie it up. And then every time you come in to have us take a look at it, we take an x-ray. Once the tooth is stabilized, it's going to need a root canal. In years past, dentists would do the root canal on the tooth before reinserting it. but that took time away and really made it a problem for long-term viability. It extended that time longer than it needed to be. All right, we're to work. Everybody have a great day.